At time for You Ask, We Answer. Once again, we're joined by Trinity Health of New England's Dr. Syed Hussain, who gives us his medical insight on a lot of these COVID-related issues and other topics. But we do want to talk more about COVID again today. Doctor, how are you today? Doing well?
I'm great. Thank you. Yes, Tim.
Glad to have you here. Okay, right now, given that caseloads are declining, they're not low, but they are really declining with COVID. A lot of this talk is moving around masking in schools. Again, tell me if I'm wrong. My understanding was that the science behind how effective they are has always been lacking and has gotten only worse ever since we know that kids have trouble wearing masks well, and that the Omicron variant has made cloth masks almost useless. I say almost. There's even a little bit of a percentage is better than nothing. But do you agree with that? Where does that science stand as far as you are concerned?
Yeah, so we definitely do need pandemic off-ramps as we try to resume life as normally as we could. And one thing I want to mention to viewers is that the mandates going away from masking does not just basically means there's no government-imposed restrictions on masking or rules related to masking. But there will, so there are a number of caveats to this. So, for instance, you need to consider if you're a parent, your child is 5 and above, has the child been vaccinated? Is everybody vaccinated and boosted in your family? If the answer is yes, you're providing the most safest environment possible with very low risk of severe COVID-19 illness. Number 2, is your child immunocompromised? Or are there immunocompromised members in your family? Another thing to consider, because if the answer to that is yes, then, a proper mask and, not excluding cloth masks, would be, preferred. And then what is the community transmission of COVID-19 in your local community? So there are a number of factors still that need to go into this consideration, but we need to like I said earlier, we need to find those off-ramps so we can resume life as normal as possible. And also we await updated CDC guidance.
Yes, yeah, and that CDC guidance, that's a big part of it too. Want to just talk a little bit more about that, about how as mandates start to go down, and you were sort of touching on this, but that is when personal responsibility starts to go up as people need to be more vigilant in making the right decisions for them. Yes?
Absolutely. It's going to be key going forward. Now, the era of mandates and restrictions and lockdowns, that's not sustainable. That we can't live like that for, the next several months or years, however long it takes for us to get this virus under control. So what we will need to do is learn to coexist with this virus. That includes using vaccination, using all the tools that we have, including more supply of drugs, more supply of testing kits, and personal responsibility will be key. Especially if you have some of the conditions that I mentioned earlier. You're in an indoor setting, it's wintertime, you have immunocompromised people or people that are unvaccinated in your family, you need to think about those public health measures. It'll come down to personal responsibility.
Yeah, and that's really a sign of progress. A lot of these early interventions and the vaccinations were part of a public health perspective, but now that a lot of people who need to be protected are protected, it winds up coming down to now just worrying about yourself. Doctor, we're actually out of time. We will have you back next Friday to talk about more things. I know there's some exciting possibilities in terms of vaccinations and new types that we want to get to too, so we will talk to you more about that and other topics again soon. Thank you for the time, though, today.